Hello friend, welcome to the channel Pharmacy Dictionary. In our last video, we have studied about the basic introduction and consequence of metabolism. Now it's time to study about their phases, or we can say their classification. This topic is going to be one of the most important topic for your sessional examination point of view, but in theory as well as in competition exam, few questions may ask from this topic. So today's topic is classification of metabolism. Basically, metabolism is a process of conversion of complex molecule into simplex molecule, or we can say in the respect of drug, the process convert water soluble drug from their lipid solubility, or we can say this is a conversion of lipid soluble drug into more water soluble drug so that the drug may get excreted from our body easily. So to achieve this process, the drug having three options, or we can say three possibilities are there for the elimination or excretion of drug from our body. First option says the drug will excrete as such without going through metabolism. And second point says the drug will go for phase 1 metabolism. After going through phase 1 metabolism, there will be a formation of metabolite from phase 1 reaction. So that phase 1 metabolite will go for the excretion. And the third and final possibilities are there. The drug will go for phase 1 metabolism. Their metabolite may go for phase 2 reaction. And after going through the phase 2 reaction, their metabolite will get excreted from our body. So these are three possibilities for any drug specifically so that they may get excreted our body. But what is the phase 1 and phase 2 reaction? I have used in this definition or clarification so that we may understand basic concept. We should know about the phase 1 as well as phase 2 reaction. This video will help you to understand this concept. So there is a classification of metabolism into two main class. So phase 1 reaction, or second one is phase 2 reaction. But this is not as important as their other name also. Phase 1 reaction is having other names too, like synonyms, as well as phase 2 reaction is having other names. So what are these other names? So classification says first classification is phase 1. This phase 1 is also known as a non-synthetic reaction. I have pointed a point over the non, underlined the word. So you have to remember this. This is non-synthetic reaction, or this is also known as a functionalization reaction. So what are the basic meaning of these synonyms? Let me clear you the first. First one is phase 1 because it is happening first time just after the distribution of the drug, and the first phase of metabolism is generally simply considered as a phase 1, safe one, or phase 1 simply. The second one says non-synthetic because here nothing new is going to synthesize, that is why it is called as a non-synthetic. And the third name is functionalization reaction because there is the addition of functional group on the molecule of the drug so that they will be easy in their excretion. So that is called functionalization reaction. So explanation is very simple and short. A functional group like OH, that is hydroxyl group, COH group, aldehyde group, amine group, thio group may be add on so that the metabolite will be formed. This metabolite which is formed by phase 1 reaction may be having two possibilities. The first one, either it will be active or it may not be active, that is inactive. There is two possibilities for the phase 1 reaction. Whereas the second classification of metabolism says the phase 2 reaction, and the phase 2 reaction is also having few other names. These names are synthetic reaction, unlike the first one. The first one was non-synthetic, where I have underlined and pointed a red dot over the non word. So here it is synthetic, that means something new is going to synthesize. And the other name is conjugation, where a water soluble molecule, that hydroxyl group, get attached to the drug molecule so that it may convert into more water soluble, and the drug or drug metabolite will easily excreted from our body in the form of urine via filtration through kidney. So this is important phases of drug metabolism. As we can see, this phase 2 reaction involves the addition of hydroxyl group because it is a very important molecule to conversion of drug into water soluble. So we can say an endogenous radicals is conjugated to the drug. Conjugation is attachment and formation of something new molecule. So it's conjugated drug. After the conjugation, what is going to be happen? So see, metabolite is most of the case inactive. As like the first one, this was unlike the first one, this was active or maybe inactive. But in case of phase 2 reaction, the metabolite is mostly, not always, but mostly inactive except few drugs. And different other points are there. Certain drug already have functional group. If some drug is already having functional group, then the drug will go for direct conjugation. And if the drug is not having any functional group over there, then the drug will go for the phase 1 reaction at an initial level. So because it is not having any functional group, the drug will go for phase 1, because phase 1 is also known as a functionalization reaction, where any of these functional group get attached. So in this case of absentee of the functional group, the phase 1 add any functional group toward the drug. Then after that particular substance will go for the phase 2 metabolic reaction. Phase 2 metabolic reaction is important over the phase 1, because in this process the drug will convert it into a more water soluble drug. This is important regarding the phase 2 reaction. So what's going to happen after that? Just after that, converting into phase 2 metabolite, the drug will easily excreted, as I have explained you the 3 possibilities of the drug elimination from our body. So this were phase 1 and phase 2 reaction. Now we are going to start about the details of phase 1 as well as phase 2 reaction. There are some types as well as some subtypes of respective phase 1 reaction. So we have to understand their names in this whiteboard section, and we'll go for detail in next whiteboard section. So phase 1 says it is having 2 types of oxidation, mainly oxidation. First one is oxidation. Let me clear you the main point first. First one say oxidation, the another one say reduction, and the third one is hydrolysis. These 3 are consequence of the first phase metabolism. But under the oxidation, there are 2 subtype of oxidation. The first one is microsomal oxidation, whereas the oxidation involve microsomal enzyme, and under the microsomal enzyme under the microsomal oxidation, there are few subtypes. These are hydroxylation. The second one is dealkylation. Third one is S oxidation, that is sulfur oxidation, and the next one is N oxidation, and the last one under the macrosomal enzyme oxidation is deamination. So this was macrosomal oxidation, and next one is non-macrosomal oxidation. This non word is important. Now next is reduction, and the last one is hydrolysis. So now we are going to study about detail in oxidation, types of oxidation process, either it is macrosomal or non-macrosomal. So let's move to the second whiteboard section so that we may continue with their details. So now we are going to study about the phase 1 reaction along with their subtype. Phase 1 reaction or phase 1 metabolic reaction is also known as a non-synthetic reaction or functionalization reaction, and this process of phase 1 reaction include the process of oxidation, reduction and hydrolysis. So out of these 3 process, oxidation process is one of the most important metabolic reaction, because it is followed by many of the drug. So many of the drug which are included under different categories like antihypertensive drugs or other category are just follow this oxidation process. So let's see what is the meaning of oxidation. We have studied about the oxidation from long time. So what is the meaning of oxidation actually? So the definition of oxidation involve either 2 steps. The first one say addition of oxygen or negatively charged radical to the drug, or if you are not interested regarding this addition process, then go for the removal. So this is also known as a removal of hydrogen or passive charge radical to the drug. The both process, either addition of oxygen or removal of hydrogen, or addition of negative charge radical or removal of positive charge radical, both are termed as a oxidation. This is one of the most important process, or we can say definition, which is followed by the meaning of the drug. So as per the difference importance criteria, oxidation is a termed or accepted as a most important metabolic reaction which are catalyzed by the monooxygenase enzyme which are present in the liver. See, there are few other metabolic site also like skin, blood, etc., but out of all, the liver is one of the most important site for their metabolism. So to metabolize any drug, the liver needs some enzyme, and this enzyme may be of different type, but here in this process of oxidation, this involve monooxygenase. Then the last word of this monooxygenase is represent that it is an enzyme. So this is important enzyme present in the liver, so that the drug can convert it into its metabolite. Now coming to the next one, that is a subtype. So there are few subtype of this oxidation process. These are, first one is microsomal oxidation reaction, and the next one will be non-macrosomal reaction. So what is the meaning of microsomal oxidation reaction? A reaction under the oxidation process which involve the use of microsomal enzyme which are secreted by the macrosomal part of the cell of the liver, that is called microsomal oxidation reaction. Under this macrosomal oxidation reaction, there are few subtype also. These are hydroxylation, That means addition of hydroxyl group. Example of this hydroxylation can be understood with the help of a small and simple equation. Example is phenytoin. This drug is useful in many of the conditions. So this phenytoin get converted into hydroxyphenytoin just after the process of hydroxylation, which is example under the microsomal oxidation reaction, and this is example of oxidation process. So we have to remember this equation and example. Now next subtype under microsomal oxidation reaction is dealkylation. What is the meaning of dealkylation? Alkylation means addition of alkyl group, but here it is not alkylation, it is dealkylation. That means removal of alkyl group. So the equation, or we can say example under this dealkylation reaction, is one of the most important conversion reaction which is included in the syllabus of your GPAT and other pharmacist exam. This is codeine. This codeine converted into morphine so that it may produce its desirable effect like analgesic effect too. So coming to the next subtype under microsomal oxidation reaction is S-oxidation. That means sulfur oxidation, or we can say it is a sulfoxide formation process where a sulfoxide is get formed due to the reaction of these conditions. Example is cimetidine. Whenever cimetidine is taken by any of the patient or person, that converted into cimetidine sulfoxide in the liver under the process of macrosomal oxidation reaction involving macrosomal enzyme, which is a type of oxidation reaction. So this is an important equation. All this equation may be asked in your different competition exam. Coming to the next one, that is deamination. As like the previous one, dealkylation, deamination involves the removal of amine group from the substance so that active substance or inactive substance may be formed depending upon the type of the drug. So deamination involves example or process of conversion of amphetamine. This amphetamine, after taking by the any route of suitable drug administration, converted into benzyl methyl ketone. This is important reaction, so you should remember all this formed product with the help of their consecutive microsomal oxidation reaction subtype. Now we have to study about the non-macrosomal reaction, or we can say non-macrosomal oxidation reaction, because it is a subtype under the oxidation process. As its name indicates, the first one was macrosomal. That was obviously involvement of macrosomal enzyme for the process of oxidation, whereas non-macrosomal reaction is those type of reaction under the oxidation process which does not require macrosomal enzyme. It may be facilitated by other type of enzyme other than the macrosomal enzyme, that is simply termed as a non-macrosomal oxidation reaction. So here you can see other than the macrosomal enzyme, like example of non-macrosomal enzymes are monoamine oxidase. Trust me, this monoamine oxidase is one of the most important metabolic enzyme which will be involved in the different conversion process, and that process will be a part of our study in a future video. So this monoamine oxidase is also abbreviated as a MAO and pronounced as a MAO inhibitor. So this MAO inhibitor is a useful substance or useful drug under the category of central nervous system acting drug, because this MAO reduces the availability of the drug and that effect may be reduced. So that to avoid that reduction of this drug, we have to use MAO inhibitor, and that is a part of next topic or next semester as well. Next example under the non-macrosomal oxidation reaction is xanthine oxidase, and we will study this xanthine oxidase under the category of gout. So anti-gout drug act on this process also. This is also a part of next topic. Next example is alcohol dehydrogenase and aldehyde dehydrogenase. Example can be concluded as ethanol conversion into CO2 and H2O. That is an important process under the non-macrosomal reaction. So coming to the next type of the phase 1 reaction, that is reduction. As we have studied in our 12th standard B Pharmacy early semester that oxidation and reduction are the both opposite process. So we can define the reduction process just opposite to the oxidation process. So let me clear you the process of oxidation first, then you will get the meaning of reduction. So in case of oxidation, there is the addition of oxygen or negative charge radical to the drug. But if you are talking about the reduction, the process will be opposite, that in case of addition, there will be removal. So what will the definition? Removal of oxygen or negative charge radical to the drug is called reduction. And whereas the same process we can also apply this definition in the second possibilities, that in case of oxidation, this is removal of hydrogen or positive charge radical to the drug. But now in case of reduction, we can say removal, in place of removal we have to add addition of hydrogen or positive charge molecule, and this process of opposite of the oxidation is simply converted into reduction process. So as like here I have mentioned that this is the opposite to the oxidation, and there are having two subtype under reduction reaction. These are nitro reduction and the example of nitro reduction is chloramphenicol, which may get converted into aryl amine, and the second subtype under the reduction process is keto reduction, and the example of keto reduction is cortisone, which converted into hydrocortisone. So these examples are very useful. You have to remember this point. So at the last, now we are coming to the hydrolysis process, which is another example or process under the phase 1 metabolic reaction. Hydrolysis is addition of water molecules so that the substance may convert it into a more soluble, water soluble we can say, so that finally it may get excreted from the urine as a excretion process. And the example of this is acetylcholine plus H2O, that is a water molecule that may convert it into choline plus acetic acid. This acetylcholine is one of the most important neurotransmitter present in our body, and that is useful to communicate the signal molecule from one part to the other part of the nerve. So this is important for their specific metabolism point of view. So if you do not want to get metabolized of your drug in upcoming classes, we have to remove all this possible enzyme. But if you want to increase their metabolism in case of toxicity or other wanted effect, then you have to support this enzyme. So it depends upon your choice of treatment. So this is a small video regarding the phase 1 reaction. Now in our upcoming video, we will study about the phase 2 metabolic reaction. That's all for the day. Thank you very much for watching this video. The reference for today's topic is K.D. Tripathi and Padmaja Uday Kumar. So if you want to take the screenshot of this presentation, you may have it after some time. That's all for the day. Again, thank you very much. Please do take care of yourself.